So my name is Jeanne Colbath, and I'm from Boston, Massachusetts, and I work at Regis College. And at Regis College, I teach complementary therapies in the nurse. Just teaching them how to use their breath, for situations where they're going to be subjected to pain, where they're going for cardiac catheterization or something. To use imagery. I used to give out imagery tapes, and I made a few for people specifically. And so those are the prime examples. So one of the easiest ones, I think, is to teach them a little bit of imagery. And it could be very simple as saying, tell me about your childhood, or where do you vacation? Get the patient to talk about it. And so to take away this, I've got to follow a certain script and pause a certain amount of time to make them, nurses, know that they can simply do open-eyed imagery by saying, tell me about your childhood, tell me about your grandchild, and just to watch that human being and their facial expression change, and they are now have hit the relaxation response. It's not so much about telling people to do this, but to invite them to explore and giving them a variety of different things that they can latch on to. There are many ways to go to New York City, and who cares how you get there? You just need to get there. And to respect what cultural backgrounds people bring and let them choose what works best for them. My journey with the Labyrinth began in 1997 when Dr. Reverend Lauren Artris was the keynote presenter for the American Holistic Nurses Association. I had no clue what a labyrinth was at all, but she told the story about, she is the person who brought the labyrinth forward in the U.S., and so I walked the labyrinth at the conference many times. It wasn't until like the third or fourth time where I got the aha and felt that it worked. And shortly after this, my mother was dying with lung cancer. And, nurse, the caregiver, the first daughter, I had to support her. But to support myself, I walked the labyrinth every week at a church nearby, and I became absolutely very wedded to that as a healing tool for just me. And it really was very, very, very helpful. So supposedly, just the formation of a labyrinth in your office space can be healing. It's a circle, the symbol of holism. So I work with the New England Labyrinth Guild, and they had been looking for underserved populations, and certainly women in prison are underserved. They get the same storyline about the history of the labyrinth, the use of the labyrinth. They get a practice run to just walk in, that they really can make it to the center and they can walk back out. And then going up and working with these women, and both those who have the possibility of release and those who do not, kind of a different group feeling. But they would say things like, this is my first time feeling peace in prison. And you could see their facial expressions melting. So I know it was helpful to them.